Hello, I'm Sunil Badve, Professor of Pathology and Lab Medicine in Indiana University. I specialize in breast cancer. The question before us today is, why is understanding clinical and pathological characteristics important in choosing a genomic assay? Uh, there are several parameters that help us understanding when to use a genomic assay and how one should use it. It is very clear that patients who have no interest in taking additional chemotherapy or endocrine therapy or are not candidates for it because of prior existing health care conditions, there is no real reason to do a genomic testing. So those category of patients would be clearly not an indicator for genomic testing. Another category of patients would be those who have cancers that have extremely good prognosis, such as those that are less than a centimeter or even less, 0.5 centimeter or something like that. Those that have extremely well differentiated characteristics, that such as tubular carcinoma. Invariably, those cases come out as having low risk, and therefore there wouldn't really be much of a reason to do genomic testing. Now, whether the same thing applies to high-grade carcinomas, that is, if you have a high-grade tumor, is much less well defined. If you look at the original paper from all of the studies, whether it's the MammaPrint study or the Oncotype study, the grade of tumor always had a very strong relationship with recurrence and a fairly strong relationship with the genomic score. So depending on the situation, those cases would be triaged as to whether those patients would merit or not merit having a genomic test. And of course, we are still talking only of ER positive tumors, and again, the status of ER is determined in pathology. So there's a clear role for understanding the clinical pathological characteristics of a patient prior to ordering any test, whether it's the choices Oncotype DX, MammaPrint, whatever it is. I think clearly there's a role for identifying the right patients for clinical testing.